As countries like Malaysia and Singapore begin to open up with very high vaccine uptake, our lives are starting to get back to how it was once before. But I have some bad news. This opening up of the economy can come at a heavy cost. A heavy cost in terms of lives lost. The reality is that as the virus becomes endemic, all of us would eventually have to encounter the virus. And despite the majority of the population already taking the vaccine, people can and will die. If everything remains the same, based on my calculations, before this pandemic is over, we can expect another 25,000 deaths in Malaysia from COVID. In Singapore, another 4,000 deaths. These numbers are still a significant number. It could have been much worse without vaccination. But these expected deaths is nothing compared to countries such as China. Can you guess how many will die in China if the country opens up its borders? It's frightening. A staggering 2 million people will die in China. It's scary. But we don't need to resign ourselves to such a gloomy fate. There are things we can do collectively and individually to prevent us from being part of the statistics and win the battle against COVID. I emphasize, we can bring down the death further. Okay, here I would like to highlight 4 things we can do to bring down the likelihood of any one of us dying from COVID. This particularly applies to those who are 60 and above and those with comorbidities who are at higher risk of severe COVID and death. Okay, let's get on with it. The first thing we can do is to put on our mask. Why? Because if we catch COVID when we are wearing the mask, we would be exposed to a lower viral load or concentration of the virus, thus reducing the likelihood of severe illness and death. So a person who catches COVID while wearing a mask would have a less severe illness compared to another person who catches COVID when not wearing a mask. Masks not only prevent transmission of the virus, it can also reduce the severity of the illness if we come down with COVID. The same also applies to being in a well-ventilated area, such as outdoors, where the viral load tends to be lower. A person who catches COVID in a well-ventilated area or outdoors would tend to have milder illness compared to a person who catches COVID in poorly ventilated areas or indoors, where the viral load tends to be higher. So to everyone, especially those elderlies who are at high risk of death, please keep your masks on when meeting friends or going to a crowded place. Resist the temptation to go for karaoke, drinking sessions, or dining in where you need to remove your masks. As far as possible, try meeting and socializing outdoors. Go for walks in the park. Dine al fresco or outdoors. With these simple measures, even if you catch COVID, risk of dying is reduced tremendously. So keep the mask on and remain in well-ventilated places. Okay, the second thing we can do is to lead a healthy lifestyle. Our immune system depends on it. Exercise has been proven time and again to prevent infections, including COVID. Eating a healthy diet, such as that packed in nutrients from vegetables and fruits, will provide the necessary antioxidants to fight infections. Our immune system also functions the best when we have adequate sleep and when we keep stress under control. Our very own immune system is the single most important frontliner fighting COVID. If our immune system is weak, no vaccine or medication can help us. Besides fighting COVID, leading a healthy lifestyle can help us stave off obesity, diabetes, and a host of other diseases which are risk factors for severe COVID and death. Okay, now the third thing we can do is to get a vaccine booster. Studies from Israel appears to show that antibody levels starts to wane 6 months after completing 2 doses of the Pfizer vaccine. Incidence of severe infection also appears to have risen in those 60 and above. A booster dose has been shown to reduce hospitalizations and severe COVID compared to those who was not given a booster. However, this information is based on observational studies which may not be as reliable as a randomized controlled trial. Nevertheless, giving a booster dose poses no major harm. So I would definitely recommend those at risk to take their Pfizer booster. Those who completed their first 2 doses using Sinovac should also take a Pfizer booster. Although Sinovac is effective, the death rate is still significantly higher compared to Pfizer. By giving a Pfizer booster to the Sinovac vaccinees, we may be able to reduce deaths by as many as 6,000 in Malaysia. So for the elderly, go get your boosters, especially those who took Sinovac as primary doses. Okay, the fourth thing we can do to reduce deaths from COVID. If we had COVID, get treatment early. Okay, previously, there really was no specific treatment against COVID. Treatment was mainly supportive with oxygen and steroids when patients deteriorate. But now, there are a few treatment options available, such as the antiviral molnupiravir and monoclonal antibodies Regencov and AZD7442. These treatments have been shown in studies to reduce risk of severe COVID and deaths by 50 to 70%. These medications, however, must be started as early as possible to have the best effect. For old folks, getting fevers or sore throats are uncommon. If you have such symptoms or the unique symptom of loss of smell or taste, it is COVID until proven otherwise. Get yourself tested early with a home test kit to confirm the diagnosis and go for treatment as soon as possible. Okay, so there you have it. 4 things we can do to reduce risk of severe COVID and death further. Keep our masks on and stay in well-ventilated areas. Lead a healthy lifestyle. Get our booster shots and seek treatment early if you come down with COVID. So stay safe, yet live our lives to the fullest. We are in this pandemic together, and together we can come out of it stronger.